Lyme disease is the most common vector-borne disease in the USA, affecting more than 476,000 people per year. Hi everyone, my name is Salma and I'll be introducing our topic. From record-breaking music artists to models, many celebrities have shared their stories of the painful impact Lyme disease has brought to them. However, it is not an illness limited to the famous. In fact, Lyme disease is the most common vector-borne disease in the USA, affecting more than 476,000 people per year. And whilst we might be familiar with it due to its exposure by celebrities, there is an underlying significant issue regarding how misdiagnosed and disregarded the disease is, leading to devastating consequences for those affected by it. Medically, Lyme disease is caused directly by Borrelia burgdorferi bacteria, found in the secretion of some ticks when they bite. As it enters the bloodstream affecting all organs, it causes an inflammatory response which presents itself as symptoms ranging from fatigue to extreme pain and dysfunction in various parts of the body. Most patients can be treated with antibiotics, but some go on to experience chronic pain and irregularities. These symptoms are vast and often the reason why many patients are misdiagnosed and labeled as hypochondriacs. Diagnosing Lyme can be difficult due to false negatives, by recognition, and vast symptoms. This can lead to unnecessary and harmful treatments. In one patient who tested negative, had his gallbladder removed in an attempt to resolve extreme symptoms of fatigue and gut issues, only to test positive 8 years later.
So why is this relevant to nursing? And really, why do we care? Because it affects the way we are going to assess, educate, and advocate for our patients, especially those that we are unsure about. As healthcare practitioners, we run into many individuals who are not quite sure they are sick or have non-specific or poorly defined symptoms. Knowing whether or not to suspect Lyme disease is important in helping them as they are suffering. They often go from one doctor to the next without getting a proper diagnosis for days, weeks, months, and even years. They can suffer endless sleepless nights questioning their condition, let alone the emotional toll trying to make sense of their body. And that is why understanding this condition helps us give care that's not only accurate, but also compassionate, making sure patients feel heard, supported, and guided toward the right treatment.
Hey everyone, my name is Asma. To support the issues surrounding Lyme disease, our group looked at peer-reviewed articles. Our first article was written by Wong and co-authors in 2022. It highlights the issue of lack of understanding and confusion around Lyme disease that leads to misdiagnoses. The author explains the symptoms from Lyme disease are often difficult to recognize and is a poorly defined term. The lack of clear definition leads to inconsistency in explanation among clinicians. So the tests being done are often unreliable and people are being diagnosed for Lyme disease often don't fit the diagnostic criteria. One study found that 60% of patients referred for Lyme disease had no evidence of having it. The misdiagnosis can lead to unnecessary therapies that could be harmful to patients. Due to the ambiguity surrounding Lyme, there have been many recommended complementary therapies that have not been validated by scientific studies, which may be harmful to the public and contribute to the confusion. The lack of standardization also may conflict patients and cause them to turn to unsafe procedures. Overall, this article indicates that how lack of education, inaccurate testing, and misinformation lead to misdiagnoses and confusion surrounding Lyme disease. The second article I would like to reference was published in 2023. It mentions how there is a rise in vector-borne diseases as a result of climate change and gaps in knowledge. Due to shifts in climate, there has been an increase in transmission of vector-borne diseases, which creates a surge. Even in new regions of Canada, it has been found that climate change is the causing spread of Lyme disease and West Nile virus. The surge of Lyme and other vector-borne diseases calls for more awareness and education, but because of this absence, healthcare providers like nurses are unable to effectively mitigate the health effects. Although there are guidelines, they are not widely implemented, creating confusion not only in the healthcare but among the public. Many nurses may not be familiar with the risks or preventive measures taken when encountering diseases like Lyme. This shows a major gap in knowledge, but also how understudied climate-related diseases are. So when people are encountering Lyme, they are often met with inconsistent or incomplete information. The authors of this article highlights that nurses are key when protecting communities' health, and because of the rise in vector-borne diseases like Lyme, they are lacking the awareness and education to create the correct preventative measures. They emphasize the urgent need to provide stronger education and awareness in this area.
Hi everyone, I'm Ayo, and today I'll be speaking about the philosophical approach to Lyme disease. In the article, we read about the health concerns of Lyme disease and how it is a growing risk that is highly intensified by climate change. As areas that used to be too cold for ticks are becoming warmer, ticks are not able to survive and reproduce in new areas, which means people are spending more time in places where ticks are present. This has led to an increase in tick-borne diseases. By learning how and why ticks are spreading, we can share information, reduce risks, and create better prevention methods. The article has a social justice approach that argues for protecting vulnerable people and demanding action. The journalist describes Lyme disease cases not just as a medical condition, but as a public health injustice, which is made worse by climate change. They call on the government to help strengthen climate policy and regulate tick populations, and provide stronger help for affected communities. It is aligned with social justice narrative since it calls for policy change and increases awareness. It addresses a wider perspective on environmental and social risks rather than first-hand stories, and it highlights society's duty to act. By combining research findings with first-hand human experiences, the social justice viewpoint improves the article and shows how climate change has a direct effect on people's health through the rising number of Lyme disease cases. Increase awareness by presenting the problem as a significant concern to human health in addition to an environmental one. Primarily, it requires action, urgency on new policies in healthcare systems, communities to help prevent harm, and adapt to changing conditions. However, the social justice approach also has limitations. First, if readers think the author is supporting a climate change agenda rather than being objective, they might doubt the report. Second, it can ignore more basic structural and political problems, such as inequality in power, land use restrictions, and unequal access to healthcare that affect sensitivity to Lyme disease. Lastly, by advocating for clear action, it can present superficial scientific uncertainty, glossing over the sophisticated and progressing relationship between climate change and Lyme disease. These gaps may weaken the credibility and effectiveness of the article.
Hi everyone, my name is Rebecca, and today I'm going to be talking about the cultural considerations of our topic, and most importantly, who's being left out of the conversation. The BBC article mentions that Lyme disease doesn't appear the same way for everyone. For example, the bullseye rash, which is a major first sign indicating Lyme disease, can look completely different or oftentimes not even appear at all for those with darker skin tones. This difference means that people with darker skin are at higher risk for misdiagnoses or delayed treatment. We see in the article that Jack Lambert, who's a professor of medicine, says that it can be misdiagnosed for ringworms, which is only a rash and doesn't have pain or memory problems. Yet many public health and medical images still show symptoms only on light skin, which is a cultural gap that continues to marginalize racialized patients. We also see in the article of post-treatment Lyme disease syndrome, there's another layer of inequality of access to care. It talks about how some patients, when frustrated by missed or delayed diagnosis, turns to Lyme-literate clinics, which are private clinics specialized in treating Lyme diseases, and may also pay for unvalidated tests or prolonged antibiotic treatments. This suggests a socioeconomic gap since people who can afford these private options are able to get treated faster, whereas people relying on public healthcare might get undiagnosed or untreated. Furthermore, in the article addressing nurses' perceptions of vector-borne diseases, it addresses another missing voice, which are Canadian nurses themselves, who feel as though they lack formal training about vector-borne diseases such as Lyme or West Nile. Especially as climate change increases tick habitat northward, without proper education or resources, nurses who also particularly serve Indigenous, northern, or rural communities struggle to recognize infections. The CASN guidelines for undergraduate nursing education on climate-driven vector-borne diseases calls for adding this content into the curriculum to prepare nurses as educators and advocates.
As future nurses, it's important that we understand how climate change and lack of education are influencing the rise of Lyme disease. Hi everyone, my name is Franky, and based on everything that's been discussed, here are the implications for nursing. Become a leader in public education, such as providing resources to communities about tick prevention, safety, and early warning signs. Provide evidence-based practice. Do not provide unwarranted or untested treatments that will likely have negative effects. Be an advocate for stronger climate and health education in nursing practice and policy. Provide holistic support. Provide care and consideration for the physical, mental, and emotional well-being of patients. Provide stronger public awareness in order to reduce confusion and allow timely treatment. By strengthening awareness and applying these into action, nurses can help reduce misdiagnosis, improve public understanding, and protect public health. And that concludes our presentation on Lyme disease and nursing awareness. Thank you for listening.